Madeline, and thank you, Amy and Anne, for inviting me as a plenary speaker. I bring greetings from the American Psychiatric Association to my subspecialty home, ACLP. So it's really a double pleasure for me to be here. And also it has been a pleasure working with our new CEO and medical director, Dr. Marketa Wills. The theme for my presidential year is a lifestyle for positive mental and physical health. This really synergizes with the ACLP annual theme for this meeting, and I'm quite pleased about it. I welcome you all to our annual meeting in Los Angeles on May 17th to 21st. We have really very interesting and exciting speakers. One of them is Venus Williams on the opening session. This time it will be on Saturday at 10:30. There are other speakers whom we have lined up. I cannot mention their names yet because the contracts have not been signed, but we have a lot of scientific sessions. And this is the theme is not only for the annual meeting, but we also have it throughout this year. I have formed a presidential work group on lifestyle psychiatry, which is developing educational curricula, as well as how to support research, and the education is at various levels, including continuing education, and also we are working with the foundation. And one thing we have done is my wife and I, we have endowed an annual award lecture, which will start with the current annual meeting. These are the pillars of lifestyle medicine: physical activity, restorative sleep, healthy nutrition, social connectedness, stress amelioration, and avoidance of risky behaviors and substances such as smoking. Why is, before I get into this slide, I want to ask yourself, want you to answer silently to yourself this question. All of us have a chronological age. Now, how old do you feel in relation to your chronological age? Do you feel younger, same, or older? In a couple of slides, I will show the implications for it. So why are we focusing on lifestyle? 80% of healthcare spending in the US is used to treat conditions attributable to unhealthy lifestyle choices. And in our profession, with our patients, this is even more pronounced. People with psychiatric illness have poorer physical health and earlier mortality. On average, about 15 years are lost, which is really tragedy. And there is a lot of potential for us to have an impact on this. And also, we are interested, as CL psychiatrists especially, we are interested in promoting both physical and mental health. And all psychiatrists should be interested in it, because we are all physicians first. And we are not simply talking about freedom from illness, we are also talking about positive mental and physical health. Okay, why did I ask you the question, how you feel, how old you feel? This was a study done in Finland, prospective study, right? It has more validity. And basically people, this applies to people above age 65 who felt younger than their chronological age. Their mortality rate in the next 13 years was about 1/3 less. So I will leave it up to your conjecture. There are various possibilities of this finding, but this is, it also shows there are a lot of things which we don't think about that we have to be aware of. One of my platforms is really to really educate people about the tremendous evidence base. We are interested in evidence-based medicine. That's quite important, but there's a lot more evidence and lot more nuances than people are aware of. Okay, I hope many of you have your smart watches. You can take a look at how many steps you logged yesterday. And we all know that physical activity is important. Studies show up to 8,000 steps per day, compared to sedentary people, you live longer, but after that it plateaus. So which brings us to the question, are there differences among exercise, among the physical activities? You can get much more out of physical activity, but this is definitely an important step. Okay, this study I like. There are two cross-sectional epidemiologic studies which show that tennis players live longer than joggers, who live longer than sedentary people. But this study is different because this is a prospective epidemiologic study. I am a tennis player, my wife is a tennis player, so I'm quite thrilled about this finding. In Copenhagen, they've asked people the baseline leisure activity. For some reason, golf doesn't figure here. But then, after 25 years, they looked at their mortality. There's no intervention, so it's just two measures. And they found, compared to sedentary people, tennis players lived 9.7 years longer, joggers lived 3.2 years longer, and soccer players lived about 4.7 years longer. So it's tantalizing. They controlled statistically for socioeconomic variables. And so obviously it's still correlation, but it tells you there are many other aspects of physical activity one needs to look at. The commonest explanation given for this is social connectedness. Many joggers jog alone. Tennis, it is social connectedness. And even among social connectedness, there are probably different degrees among different leisure activities featured here. I have, in addition, two other explanations. One is adherence. If you are a solo jogger, it's very easy not to adhere. Remember, this is only baseline, and then that's it. And whereas if you are a tennis player, you are going to be adherent. I play tennis at 6:30 in the morning, 3 times a week, and no matter what happens, I show up on the court at 6:30. And the other explanation is this is not shown for physical health, but for mental health, for depression and anxiety. There are studies showing that competitive sports improve your mood better than non-competitive physical activity. Again, competition has to be within moderation, right? It has to be challenged and within control and enjoyable. And so again, tennis, probably compared to jogging, that fits that category. Now, it's not exercise is simply good for our cardiovascular fitness. It actually produces changes in our brain anatomy and physiology, right? We think of the brain as non-malleable. And you all know that in patients with schizophrenia and dementia and depression, the hippocampal volume is lower. And exercise is a very powerful stimulus for hippocampal plasticity, much more than what you might have imagined. This study was done in Munich with patients with schizophrenia who were, they were given 3 months of exercise on cycling, on stationary bicycle, 30 minutes 3 times a week. They exercise what we call a sub-lactate threshold, because you know that once you break the lactate threshold, then you are not clearing your lactate as fast as it is accumulating, so it causes soreness and you cannot do the endurance exercise. So this is fairly intense. And the comparison group of patients played tabletop football for the comparable time. And then there were also non-patient people who exercised as controls. And following exercise training, those people who exercised, there is an increase in hippocampal volume. In patients, it was 12%. In healthy subjects like us, that's a good news, 16%. Whereas in non-exercise group, there was no change. This is not simply an anatomical change. There also was a reduction in negative symptoms in patients with schizophrenia, and in both the groups, cognitive testing revealed some improvement. And there is also a plausible neurochemical pathway. There was an increase in N-acetyl aspartate, which is a marker for hippocampal plasticity. This is one patient. The top half of the neuroimaging shows the hippocampal volume. The blue thing really shows on the right side. And the bottom is after 3 months of exercise. You can see the increase in the hippocampal volume. This small sample size, but the effect was so powerful. That's the reason it reached a significance. Only one person in the exercise groups did not show increase in hippocampal volume, whereas in the non-exercise group, only one person showed increase in hippocampal volume. And guess what? That person was an SSRI. And SSRI is also one of the mechanisms of that action is by increasing hippocampal volume. Both of them actually act through BDNF. I'll tell you more about it. There are other psychiatric conditions, like our bread and butter depression and anxiety, where physical activity and moderately intense exercise are very powerful therapeutic modalities. This one done in Amsterdam, 16 weeks of running did as well as escitalopram in terms of achieving remission. It was an intent to treat analysis, and you notice that only 52% of the exercise group was adherent, whereas 82% of the medication group was adherent. In spite of it, it was equivalence. It shows how powerful the exercise is. And also, runners had other benefits, like in terms of the metabolic profile. So it's not a question of advocating exercise instead of medication. My view is you have to treat depression or other disorders with psychotherapy, medication, other interventions. But no matter what you do, include physical activity and nutrition and paying attention to sleep. I will not address many of the life pillars because we have a limited time, but I will address only nutrition after this. So brain-derived neurotropic factor is actually release is increased when we engage in aerobic exercise. And also people with depression and anxiety disorders, they have lower BDNF levels. And there is also gene environment interaction, and people who are subjected to trauma with a particular genetic variant, they do not express BDNF that well. Nutrition, good news is nuts, seafood, berries, dark chocolate, they all promote BDNF release. And there's a famous study called the Predimed study done in Spain, which really looked into the effect of Mediterranean diet on cardiovascular outcome. And they found the addition of olive oil or addition of 1 ounce of nuts a day that increases the cardiovascular outcome and reduces the stroke risk. A sub-analysis revealed that in people who were depressed, if they are given 1 ounce of nuts per day, their BDNF level went up. And it also reduced the risk of incident depression in subjects with diabetes. There was a famous study in Australia. Again, we are all talking about interventional studies because that's the gold standard, right? Otherwise, it's all correlational. These are prospective interventional studies. Dr. Jacka, who did this study, she will be a speaker in the AP annual meeting. 12 weeks of a nutritional intervention compared to what they call the social support, which is really a kind of a controlled condition. This was to do with people who were treatment resistant. And so the remission rate was 32%. Many of these patients actually had poor diet, as unfortunately many of our patients have. And so in any patient whom you treat with a depression, you have to pay attention to nutrition. The number needed to treat in this trial was 4, which is phenomenal. And basically the diet has a Mediterranean diet with a lot of whole grains and vegetables and fruits and legumes, and avoiding, minimizing sugar and simple carbohydrates. So there's also inflammation is another pathway for many psychiatric as well as medical conditions. The anti-inflammatory diets are, there are two kinds of diets, Mediterranean diet and whole food plant-based diets. And both of them have plenty of vegetables and fruits and fibers. And they are also antioxidant, because they are rich in polyphenols, omega-3 fatty acids. For omega-3 fatty acids as supplements, there's no evidence for protection against heart attacks. But for mental health, there is evidence. In people who do not take fish, seafood, omega-3 fatty acid supplements are protective against heart attacks. So probably there is a dose that you need, and excessive doesn't contribute much. And the microbiota, they play a major role. And so there are studies done, interventional studies, giving probiotics and showing improvement in depression. And diseases like schizophrenia, the microbiota play a role. If you take fecal material from patients with schizophrenia and give it to mice, that shows some behavioral changes. So my action plan, apart from the work group and the annual meeting, and I'm also giving lectures nationally and internationally like this. And also, I'm spearheading a fundraising for the APA Foundation. Please take a picture of this slide because it has the website for you to donate to. And if you can go scan the QR code now and contribute immediately, that will also be good. The American Psychiatric Foundation, it does wonderful work in the community. We have activities in schools, colleges, workplace, and the general community. And so what we want to do is to include lifestyle education and interventions as part of the great work they're already doing. And by the way, the Academy also has a foundation. Please contribute to that also. Any foundation is important for us to contribute. On top of it, please contribute to the American Psychiatric Association Foundation thing. So I hope this has been, there are a couple of other things which I cover in a more extensive lecture on nutrition. There are some small things which can make a major difference. For example, broccoli and other cruciferous vegetables, there are a lot of evidence to show, mainly correlational and also animal experiments, that they are protective against cancer. And that has to do with sulforaphane, which has to be, it's not innately present in the broccoli. There has to be an enzymatic reaction for sulforaphane to be produced. And that happens only if you injure the broccoli, like cut it or squeeze it. If you straight away boil the broccoli, then the enzyme is lost. Then you do not get any sulforaphane protection. You get the other benefits of green vegetables. So before you cook broccoli, make sure that you cut it and let it aside for about half an hour or so. And also when it comes to nuts, 1 ounce of nuts a day, it's very easy for our patients to do. It's much easier than running half an hour daily, right? And at the same time, you have to do both. But nuts, beans, and lentils, legumes, they have a lot of protective power. They have high protein, high fiber, polyphenols, and antioxidant and anti-inflammatory. And caffeine, many of you drink coffee. That's very good. And but the trick is, if you drink the coffee with milk, then the polyphenols from the coffee do not get absorbed that much. So if you drink black coffee, then you get more bang in terms of coffee. Coffee is neuroprotective, protection against Parkinson's and other dementias. So there are small tweaks you can do in order to enhance the nutritional punch. So I hope this has stimulated your thinking. The field is quite large, and you will learn from other excellent speakers in this conference and in the APA annual meeting. So again, I invite you all to come to Los Angeles next May. Thank you.